We've shown you the life-saving benefits of lipoprotein apheresis for patients like this little girl born with dangerously high cholesterol. Today, see how this same treatment is helping pregnant women with a condition that could affect their hearts and their babies. Why this mom says it is the reason she has her miracle baby. Good morning. We have a great program for you today. I'm Alexis Del Cid. Welcome back to All Things Heart. Danielle Harp struggled with high blood pressure for years. It's what sent her to the hospital in 2015. She was diagnosed with something called lipoprotein A. It's also known as Lp(a). This is when you have an extra protein that is stickier than the other types of LDL cholesterol. That makes it easier for blockages to form. It's also known as a risk factor for heart disease and cardiovascular issues. And Lp(a) can also increase your risk of stillbirths and preeclampsia. Preeclampsia is the most dangerous form of high blood pressure during pregnancy. It's the leading cause of maternal death across the world. 1 in 25 pregnant women will develop it, which is why when Danielle Harp got pregnant in 2024 and developed preeclampsia, she was so concerned. But Danielle's doctors had a groundbreaking plan to treat it. It's called lipoprotein apheresis, and it is initially used to treat high cholesterol in patients like the little girl we introduced you to in a previous episode.
They put the needles in and then they clean my blood.
10-year-old Aubrey Bell knows more about science and medicine than anyone her age should.
When I was 2.5, I got diagnosed with it.
She's had plenty of first-hand experience.
It's about 8.5 hours here and then it's 8.5 hours back.
And even though it's grueling driving to Kansas City every 14 days from their home in South Dakota, causing her parents to miss work and Aubrey to miss school, they feel fortunate.
There's a good chance I wouldn't have a daughter anymore if we weren't getting this treatment.
This therapy of apheresis is very rare in the United States for treating this kind of disease. Now we have the largest center in North America. We treat more patients here at KU than all of Boston, New York, Chicago, LA, combined.
Aubrey has familial hypercholesterolemia, also known as FH. It's a genetic disorder that makes Aubrey's bad cholesterol sky high. Medication won't lower it. The only thing that works is this treatment, administered by Dr. Patrick Moriarty at the University of Kansas Health System. It's called lipoprotein apheresis.
The cholesterol goes down in the red bucket.
These machines filter the bad cholesterol from Aubrey's blood and then put the clean blood back into her body. But reaching Dr. Moriarty and his team was a 5-year-long process, even though the signs were there beginning when Aubrey was just 2 weeks old.
They just said it was probably a fungus or something.
Her mom, Jade, says she noticed orange patches developing on her baby's skin. She says the doctors in South Dakota told her it was because she wasn't bathing her properly.
It was frustrating that I was being blamed.
Over the years, the orange patches got worse, and still, she says, the doctors wouldn't listen.
It honestly almost looks like orange sherbet was the shade of the orange, and it looks like little bubbles, like kind of like a smaller blister.
It looked like an orange peel.
Finally, she drove 2 hours to a dermatologist in another town who correctly diagnosed the orange patches as xanthomas, and further testing revealed something horrifying.
He did do a biopsy and a blood draw, which her cholesterol was almost 1,000 at that point.
There was so much cholesterol in Aubrey's tiny body, it was seeping out of her skin, creating the orange deposits.
I always say go with your gut feeling. As a mom, you know when something is wrong, and unfortunately, sometimes we have to be our own advocate and push for the answers that we need.
It was Jade's persistence that landed them here for this treatment, a place where Aubrey is surrounded by a care team that has really grown to be like family.
They're so nice. They spoil me. Halloween, my birthday, Christmas, Thanksgiving.
And she has big plans for the future.
I want to move to New York and be a fashion designer.
She's so cute, and today that little girl, Aubrey Bell, is doing fantastic. This morning, Danielle Harp joins us virtually. She's the mom that went through the same therapy to treat her preeclampsia when she was pregnant. And we are also joined by her two amazing doctors who are in the studio here with us this morning. Dr. Mark Parrish. Dr. Parrish is a maternal and fetal medicine specialist. And Dr. Patrick Moriarty, who you saw in that story at the top of the program. Dr. Moriarty is the director of the Lipid Apheresis Center here at the University of Kansas Health System. Thank you, doctors, for being here this morning. So glad to have you on. Danielle, I want to get right to you. How are you feeling today, and how is your little girl?
I am doing actually really well, and she is great.
How old is she now?
She's 9 months.
Look at that little face. Tell us more about her. What's her name? What's she like?
Her name is Olivia Marie. Very rambunctious. She is energetic, very nosy, on the move constantly, and just a joy.
She's like the mayor of your house, right? She's always on the go, making the rules.
Yes, she's 100% the boss.
That's how it should be. We like those strong baby girls grow into strong women. Let's talk about preeclampsia. You went through something really scary, and the symptoms can include headaches, vision changes, swelling of the hands, feet, face, or eyes, and then when it moves into eclampsia, seizures. Did you experience those symptoms?
Yes, especially towards the end of my pregnancy. I had headaches that would not go away. A lot of swelling. By the time I left the hospital, I want to say 2 weeks after I gave birth to her, I had already lost 20 pounds from the swelling.
Gosh.
Yes.
How high was your blood pressure when you first met Dr. Moriarty?
When I went to the hospital, it was in the 180s over 130s.
Oh my goodness. Dr. Moriarty, does Lp(a) always cause preeclampsia?
No, not necessarily. It's found, Lp(a) is found in 20% of the world's population. 20%.
20%.
20%. And it's genetically predisposed. 99.9% of it's related to genetics. And when you do have pregnancy itself, it can activate the Lp(a) to go higher in the patient's blood. But it doesn't necessarily. It's a risk factor that Dr. Parrish explained to you about preeclampsia and risk factors. But I saw Danielle back in 2016 for her blood pressure and her high Lp(a), and unfortunately she had a miscarriage before this pregnancy occurred, and I knew at that time that it probably had an association to Lp(a), and that it should be addressed, and that's when Dr. Parrish got involved with Danielle's care.
That's when you both teamed up to help Danielle. How common is it for you to team up with Dr. Moriarty for this kind of therapy to treat women for preeclampsia?
I would say that it's going to become more common. It's currently not very common at this time, just because Dr. Moriarty is the one that I think brought it to my attention that that Lp(a) could have an association with preeclampsia, and I started doing my own digging on this, and it just made sense to me that somebody that has a situation that can raise their cardiovascular risk. We know that preeclampsia in and of itself is a cardiovascular derived disorder, and therefore when we were talking about this and I did a little bit more digging, I was like, this is definitely something that would result in adverse pregnancy outcomes. Because of that, we've subsequently had at least one other patient, maybe two others that we've treated together, and we are now working with the company that provides the machine that does the apheresis for these type of situations to start looking at the safety of this in pregnancy. But we definitely believe, based on some already pre-existing studies, that the safety has been proven. We just need to prove it here in the United States. But we know that it will have a positive impact on pregnancy outcomes for these patients in the future.
And you can see it with Olivia, just a perfect little baby. We have so many great pictures that Danielle has shared with us. Danielle, what do you remember Dr. Moriarty telling you about the risks at that first appointment and then when you met Dr. Parrish?
Luckily, I had my yearly appointment with Dr. Moriarty probably a week and a half, 2 weeks after I found out I was pregnant. And I just remember, I was talking about my miscarriage and him saying that it could be a risk factor for stillbirths or miscarriages, and my heart sank. But it only sank for a short period because he was like, but I have something that I want you to try.
Oh, wow.
Yes.
Well, first of all, I am so sorry for your loss. And thank you for sharing that. I know that's very hard to share, and you went through a lot. And a lot of women out there, their hearts ache when they hear you talk about that. But so happy when we see your little baby now. When it comes to Lp(a) during pregnancy, what typically happens?
Well, unfortunately, what typically happens in this country is not much. As I mentioned previously, 20% of the world's population have an elevated Lp(a) due to genetics. Right. And because of this, the European and Canadian guidelines recommend universal testing for all adults at least once to see if they have it. Unfortunately, in this country, less than 1% of all adults in this country have been tested for Lp(a). Less than 1%. And it's a one-time test. Once you show you have it or you don't have it, you can just move ahead. And unfortunately, it's not being practiced aggressively now. And the reason, one of the reasons is there are no drugs officially approved for treating Lp(a) as of yet. We're working on drug studies now that do lower it up to 98%, but they're still in phase 3 trials, and we'll find out the first study will come out sometime late next year, and hopefully they'll show benefit besides lowering Lp(a). So right now, the only thing that's approved for Lp(a) by the FDA and by insurance companies and Medicare is lipid apheresis. If you have cardiovascular disease and you have an Lp(a) above 60 milligrams per deciliter or 130 nanomoles per liter, you're approved for treating with apheresis.
Okay.
By the FDA, that was passed a year or so ago, and insurance and all Medicare patients are covered by it. I have a lot of patients on. I have 61 patients on my machines for chronic cardiovascular disease. They've had heart attacks, strokes, PADs, and so forth. And now we were just in Canada, in Montreal, at the American Society for Apheresis, and we showed a 90% of cardiovascular event reduction in patients who had known cardiovascular disease with high Lp(a). In 5 years on apheresis, we show a 90% event reduction.
It's remarkable what you have. We have right here at the health system. Dr. Parrish, you break into a big smile when he's talking about this, this resource that is here. How often then would you say you're able to have patients treated with lipoprotein apheresis? Is Danielle just one of a handful, or do you have a bunch of patients you can send to him?
Yeah. We're actually, to Dr. Moriarty's point, the testing isn't being done in adults that would meet the criteria from a cardiovascular risk standpoint. It's certainly not happening in patients that are younger mothers who are, have had pregnancy or adverse pregnancy outcomes. But what Dr. Moriarty and I have talked about, what we're trying to change in our own practice, but it's going to take somebody shining a big bright light in the sky to make this happen. But to look at patients that had adverse pregnancy outcomes, have had pregnancy losses, whether it's a miscarriage, whether it was a stillbirth, it's horrible that it would have to come to that this event has to occur before we realize it. But I think that if we have a more universal screening for this type of looking at the Lp(a), that maybe we're going to identify more of these patients. And certainly now we're in the process of not necessarily targeting these patients with an abnormal lab value, but rather when they are getting diagnosed with preeclampsia early in the pregnancy. We're working on a study. The approval process is in place right now. We're working on getting the approval of it. But once that happens, and we're hopeful that we'll start enrolling more patients, and then that's going to shine the light even brighter on this technology that is there that could have a huge impact not only on patients with cardiovascular problems, but also our mothers with preeclampsia, which can result in some very bad pregnancy outcomes if it's not managed appropriately.
Dr. Moriarty, you were talking about this huge percentage of people in the world that have this. Right. Is this a test that patients can request? Like, Dr. Parrish, if Danielle had come to you and said, I want this test, could you have ordered it for her?
Yes.
And does insurance cover that typically?
Yes, there's codes, ICD codes that cover it. And because diet, exercise, and weight loss has no effect on it, fasting, you don't have to fast because it doesn't change its levels. It's the same as it is no matter if you're fasting or not. But I want to interject about our study that Dr. Parrish is going to be the PI for here at KU.
Okay.
And we're going to be using lipid apheresis for preeclamptic women, irrespective of Lp(a) levels.
Okay.
Irrespective, because this device not only lowers Lp(a), it lowers a massive amount of inflammatory markers that are associated, some with preeclampsia. It lowers also viscosity. It changes your blood from like ketchup to like tomato juice. So increases microvascular perfusion, and it lowers and improves HDL functionality, meaning the HDL, which is good at cholesterol, can be good or bad depending on how many proteins are bound to it. And this machine takes out the bad proteins bound to it to make it work even better. And Dr. Parrish has been shown that these HDLs that are bad can be also associated with preeclampsia.
Okay.
So it's a vast amount of benefit to the vascular system, and Dr. Parrish should be the PI here of running that study. In fact, he's going to be in Bangkok this coming July presenting the study at the International Society for Apheresis.
That's remarkable how both of you travel the world. I'll try to call you and you're somewhere out of the country, and you're out of the country flying all over, because we have the top specialists right here in Kansas City at the health system. Just so people can understand how this works who don't have a medical background. The story we did shows that there are these buckets, and it's removing the bad cholesterol from that little girl Aubrey's blood and putting it into a bucket, then putting back the clean blood into the body, which helped with her lower her cholesterol. Mm-hmm. How does that also help lower blood pressure? Is it lowering the viscosity of it?
So as I tell my patients, I change their blood from like ketchup to like tomato juice.
Okay.
And think of pouring ketchup through a straw compared to tomato juice. The latter is much more efficient.
Right.
So the work that the body has to do to push the blood around is much less stressful, so blood pressure can go down in these patients based on the efficiency of their body.
So Danielle went in every month for this treatment. Danielle, how long did each treatment last when you came in for it?
It varied. It took a while. Typically, and I think mine took a little longer than some people. It took mine about 4 to 6 hours to complete.
So would you have to take a day off of work to come in? I know that the little girl we interviewed, her parents are driving across the country, and it takes them a couple of days because this is the place they can get it. What about you?
Yes, luckily I live in Olathe, so I'm not that far from KU, but yes, I would take off of work for that day, so that way I could go and get the treatment.
When we were talking on the phone, you also talked about some complications you had, including an allergic reaction. Can you explain what happened?
Yeah, so the good thing is I had to take allergy medicine every single time that I went in, but it would just happen randomly. I would get nauseous, lightheaded, my face would turn bright red, I would get a headache. So it was one of those, but it had its little complications for that, but it was totally worth it.
Obviously, when it comes to this sweet little baby, I just can't get enough. I just want to squeeze her little legs and her little cheeks. What was the birth like for you? Were you induced?
I was induced. I was induced at 37 weeks. I went in on a Wednesday morning. After a couple of days, though, I hadn't progressed any, so we did end up doing a C-section Friday morning about 3 a.m. So with that, it was crazy. I was on magnesium and stuff because of the preeclampsia. And so that kind of caused some of the complications during that time period as well. And so, yeah, we ended up having a C-section, and she just, I'm so happy.
I can tell you're just glowing, as you should be. Dr. Parrish, did you know your team was going to have to make that decision with Danielle?
We were watching her closely. We knew that there was a significant risk that she would develop preeclampsia because of her history of the elevated Lp(a). So because of the close monitoring, we were seeing that her blood pressures were rising. We were having to increase her antihypertensive medications at the end of the pregnancy. And Danielle started having the symptoms that are very worrisome to us, that we were getting to a point of no return. But we were so fortunate that because of the apheresis, if it wouldn't have been for the apheresis, this delivery could have occurred much earlier than 37 weeks. And at 37 weeks, mean, I don't think Olivia didn't have to spend any time in the NICU, did she? So it's
oh, thank goodness.
it's amazing because this a lot of times this disease process, and I think Danielle, if she hadn't gone through the apheresis, the delivery could have happened much earlier, which has a tremendous impact on not only survival rates for these kiddos, but their long-term health and outcomes. The earlier that you deliver, the more risk there are for permanent injuries to occur to these kiddos because of prematurity that could result in lifelong disability. So this apheresis in these type of situations, not only for patients like Danielle, who we know have these risk factors, but for those patients that we don't know have those risk factors that come to us very early in pregnancy with a diagnosis of preeclampsia, having apheresis as one of our tools, I think is going to make a tremendous impact, not only for future maternal health, but also for the lifelong well-being of the child.
Dr. Moriarty, the research that led you to know this would help women with preeclampsia, what did the research show you?
This research I've seen, I have a colleague of mine in Germany, a woman named Dr. Beata Roxanne Jaeger, who did studies on preeclamptic women and showed that the treatment with the patients with preeclampsia with high Lp(a) and they're using apheresis could extend the pregnancy by 14 to 50 days.
Which is huge.
Which, and Dr. Parrish can tell you, is life and death for mother and fetus.
And Danielle, how soon were you back home with Olivia?
I had her Friday morning and was discharged Sunday.
Oh my gosh.
So just a couple of days, yes. And she came right home with me. No NICU, nothing like that. She was healthy as can be.
What's her birthday?
It is 8/16/24. It's my grandmother's birthday, actually.
Oh, that's so sweet. So she's coming up on a birthday this summer.
Yes.
That is fabulous. The emotions you must have felt after everything you went through. Did you feel like you couldn't get home fast enough to be in that her little baby room with her and put her in a bassinet and be right by your side?
100%, yes. I was so in love. I was ready, to be out of the hospital and just bring her home and enjoy her.
We have some wonderful questions coming in. If you have a question or if you have a comment that you'd like to share with Danielle or the doctors, send it to us right now on YouTube, on Facebook, or on the All Things Heart email. We have all the links on how you can connect with us in real time right there on your screen. Dr. Parrish, we know preeclampsia is routine during pregnancy. So without lipoprotein apheresis, what would be the other treatment plan?
We wait and watch and try to keep their blood pressures under the best control that we can. But the problem is it's not just blood pressure. It starts to cause end organ damage. The level of the liver, brain, kidneys starts to affect very important blood products that can potentially cause patients to start bleeding to death, or the medical term would be DIC for us. So there's blood pressures we can control until a certain point, like in example of Danielle's, where we had maxed out her antihypertensive agent and it was time to be done. Thankfully, that was at term. But it's in these patients that if you can control blood pressure is great, but if you start seeing evidence of end organ damage, we don't have anything else to do except to deliver. And we're hopeful that in the majority of those cases that we can try to put a Band-Aid on things until we get to a point where we have a great outcome like Danielle did, but we don't have any really good tools at this point that are at the ready for use. I'm hopeful that one day here in the very near future that apheresis is going to be one of those tools that helps us to have have a positive impact both for mom and baby.
Danielle, what did the lipoprotein apheresis treatment feel like as you were going through it?
It was different. Sometimes your veins wouldn't like it and it would vibrate. It was a very odd feeling.
Like what would vibrate?
But it really, yes. You could feel them vibrating.
Yeah.
Yeah, the veins, I think there's a delay. The veins would vibrate in the arm, but it wasn't bad at all. My husband went with me every single time. And so we were able to talk, or watch TV or do anything like that during the process.
How did you feel tired afterwards? And I ask because the little girl whose story we showed said afterwards she would want to sleep a long time.
Yes. Yep. The first thing I would do would be come home and take a nap. I would not go back into work that day, no matter what time it was finished. So yeah, it definitely made me very tired.
And I think it would be so odd to be looking down and see the buckets and know your blood's being removed and certain things are being filtered out and put back in. Did you take a lot of pictures, or were you trying not to think about it and just staying still?
I was trying not to think about it and just stay still. The picture you guys showed is the only picture that exists while I was doing the treatment.
I want to go to some questions from some of our viewers because we have quite a few coming in. Anne has a great question. Did insurance cover this for Danielle? And if not, how much would it cost without insurance? So Danielle, first, did your insurance cover it?
Yes, thankfully. Dr. Moriarty had warned me that a lot of times insurance didn't cover it, but they were both ready to, do the peer consult and stuff to make sure that it was covered for me, but it covered it immediately.
How much would it be if her insurance didn't cover it?
It varies how much price they charge. $5,000.
You just know it's going to be high if insurance isn't covering.
What was nice for her that I did a peer-to-peer with their medical director.
And what does that mean for our viewers who don't know what peer-to-peer is?
Peer-to-peer is when you have to deal with an insurance company to get approval for something, a device, drug, whatever, procedure, and you have to talk to their medical expert.
With the insurance company.
With the insurance company. And many times I'll be talking to sometimes a dentist or a dermatologist who are very good in their field, but when I talk about this, to I don't understand this. So I was lucky to have an internal medicine doctor who understood L. pylori, understood apheresis, and was very open and understood the risk that Daniela and the baby was going through and approved it. So we were very fortunate.
Thank God.
Thank God is right.
We've talked about
insurance company.
Thank that the other peer on the other end of that call who knew that
she saved. And I haven't talked to her, so I should get back to her. And maybe she knows about Daniela's success.
Send her some pictures of Danielle's baby.
Yes.
Hey, this is what you helped make happen. Derek has a question, and we've touched on this, Dr. Parrish. Derek wants to know how common this treatment is. Is it widely available to pregnant women? And you've said, no, it's not, because people don't know about it. So my question, what would it take to make this widely available?
So first we have to get FDA approval, and part of that process is doing something called a feasibility trial. And we're going to be one of a handful of centers in the U.S. that's going to be doing this trial. We're basically showing that it's safe to use in pregnancy and that it works. But as Dr. Moriarty had said, that these studies actually exist outside of the walls of the United States. We have shown that apheresis is safe in pregnant patients. We have our own examples with Danielle and with some other patients that have had a history of hypercholesterolemia or elevated LPOA.
But Danielle wasn't part of a study. This was the treatment plan. This was her.
That's correct.
Yeah.
She was part of the treatment plan.
Yeah.
Because that's all we had for her.
Yeah.
So just need more awareness.
More awareness. And I think that with this study that we're doing and being able to get in front of cameras like we're doing now.
Could this be the big bright light shining on it that you're talking about?
Yes.
Okay.
I think that this will be hopefully just bring this to the awareness of others out there, and hopefully it'll continue to spread.
We have one more question, and then unfortunately we're out of time. Wish we could keep you for. We need Danielle to come back with her baby. I want to see Olivia in person. You're in hot demand. Yeah, everyone wants to see you. Real quick, Dr. Parrish, can preeclampsia happen to anyone, or does it only happen to women who already have high blood pressure?
Preeclampsia can happen to anybody. If you just looked at a big picture, it's impacts 7 to 10% of women worldwide in pregnancy, irregardless of what pre-existing conditions that they have.
As we wrap up this conversation for today, but hope to have you both back again, and Danielle too, I would love some final thoughts from our guest. Danielle, what would you like our viewers to know?
I think the biggest thing is get this message out there. I'm very fortunate. I already had a relationship with Dr. Moriarty, and so I was able to get into the treatment quickly. But a couple hours, every month of being uncomfortable is just 100% worth it. I would do it again in a heartbeat.
I love the video we're playing next to you, and I hope we can keep these pictures up as the doctors give us their final thoughts. Dr. Parrish, what do you want our viewers to know as they look at Olivia? Little baby.
Yes, looking at Olivia, this is our ultimate goal for every pregnancy, is to have a beautiful baby as the outcome, a baby that is not going to have to experience any hardships or difficulties because of being born prematurely. Preeclampsia is a real disease process. It can happen to anybody. If you are pregnant or planning to become pregnant, have a conversation with your family practitioner, your internist, with your obstetrician gynecologist. Ask these questions. There are things in place now that we can do to help to decrease the chances of preeclampsia happening. But once it does occur, you need to be hyper aware of those signs and symptoms. And be your own advocate if those signs and symptoms do start to manifest themselves. And certainly we'd be happy to see you here at the University of Kansas if you do have any questions or concerns. And hopefully we'll be able to help you to have a healthy pregnancy outcome as well.
Dr. Moriarty.
Well, I'll talk about the Lp(a), that besides preeclampsia, you have to worry about its association with cardiovascular disease, heart attack, stroke, peripheral arterial disease. 20% of the world's population have it, and once you're born with it, it really doesn't change.
Right.
It might go up in menopause for women because estrogen keeps it low, so once you lose your estrogen, it can go up. Oh. And if you haven't had your Lp(a) checked, you should ask your doctor why and get it checked. And right now, the only treatment for people with high Lp(a) and cardiovascular disease is lipid apheresis. Also, for LDLs above 70 milligrams per deciliter, it's lipid apheresis. But the good news is there are drugs under investigation that we're part of here now. We're doing the trials that look promising in lowering Lp(a), and hopefully the studies will show that they lower cardiovascular events on top of it. So time will tell.
Thank you so much for being here for this conversation. A lot of people watching are it's really gonna hit home for them. And Danielle, thank you for sharing your journey. It's so personal, and we are so happy that you agreed to come on the program and share pictures of your sweet baby girl.
Thank you. And I'm happy to be here.
We're thrilled. And to our viewers at home, if you'd like to watch or share any one of our previous episodes, just scan the QR code that's on your screen right now. It will take you to a list with links of all of our past episodes. Coming up next week on All Things Heart.
I was born with a heart condition called tetralogy of Fallot.
That's when 4 different heart defects develop all at once. And lo and behold, there was a 5th problem for this patient. On the next All Things Heart, we're going to show you the science that made it possible for this patient, who is also a sonographer and mom, who works right here at the health system, live a full active life. That's Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update, meet a grade schooler living with his mom's kidney inside of him. I'm Jessica Lovell on the next Morning Medical Update. We check up on little Brennan, born with prune belly syndrome, and see how life has changed with his new life-saving organ. Friday at 8.